My name is Dr. Suniza. I'm from University Malaya. I'm actually breast surgeon, and breast surgeon is not much involved in terms of, we are in tertiary, so we are not really in the preclinical, but because what reality happened during my clinical assessment, clinical examination, we see a lot of patients that I will show you later that presented at late stage. So I think that is the reason why we do such early, what we call that a REBOM cancer care in primary care short course. REBOM stands for reducing barrier in cancer early diagnosis in B40 group. So this is basically REBOM cancer care in primary care short course is basically an online training. So this is meant for general practitioner, and on behalf of the UMCRI Cancer Education Group, and we have a lot of collaboration. You can see from the right side until the other end is like it's not only us, but with other collaborators like PERCA B40, Project ECO, MMA, Medical Malaysian Association, AFPM, FMSA. So this is not only about our project, it's involved a lot of people. So to ensure that it's a success. Next please. So I think a lot of us already mentioned about the top 10 cancers in Malaysia, and you can see breast cancer, colorectal cancer, lung cancer, and what we found that the challenges in our this is basically a female breast cancer survival. Just now we're saying the lung cancer is worse than us. I thought that the breast cancer is already worse, but it's actually breast cancer is worse at 66.8%. It means that half of our patients, survive after 5 years, as compared to Japan and USA, where most of them, 88.8%, 100 people, 88 of them survive after 5 years, as compared to us, only 66%. And what is the biggest challenge when we talk about managing a patient with a cancer is because of late stage presentation, and this is been actually proved by, our recent statistic, Malaysian National Cancer Registry reported alarming increase of late, especially breast cancer diagnosis increased from 40.1% to 47.9%. It means that half of our patients presented late at stage 3 and stage 4. And it is not happen in breast cancer only, but also in colorectal cancer, cervical cancer, and also lung cancer. So why is there a delay? It can be, I will show you the picture, because most of the time when I present, I used to click myself. So now I have to make a movement with the other assistants. So a bit difficult for me to control. So that's why there will be instruction in between my, my talk. So the next picture is some of you might feel like it's an eyesore. It's a bit disturbing, but this is the reality in Malaysia. And what you can see, this in University Malaya Medical Center, where we are in the urban, so-called urban area. We are not talking about at the rural area. This is urban area, where we found that this is our patient, were presented at like this, and you can see how, when you talk about patient, what is my patient is my patient. So to ensure that this patient, to come to you in early stage, not like this. As what you can see, this patient at least presented at stage 3 and stage 4, at least stage 3, So if you see this in urban area, so what, as you compare to the rural area, I think it's even worse, even not been reported, So it can, as what we have discussed earlier, it can be patient delay because of socio-economic and whatever that our nurse mentioned, our matron mentioned just now. So the next one would be the health system delay. So the health system delay is not only happen in the hospital, but it's also happen in the pre-hospital. So who is the person in the health system in the pre-hospital? That's why in what we call early diagnosis, so the timely resolution of diagnosis from a patient's symptoms until the diagnosis is acceptable is about 60 days. And what we found that early diagnosis is a better survival outcome. Of course, if you compare stage 1 to stage 3, so the better outcome for the stage 1 disease, it improves experience of care, reduce morbidity from the cancer treatment. As you know, the cancer treatment also can have a lot of side effect, you know, and then the improved quality of life. Early diagnosis is actually is the recommended treatment or recommended cancer control strategy, especially in Malaysia, that we don't have a screening program. We only have an opportunity screening program as what we normally do. If a patient comes with a breast lump, for example, if it's not cancer, we still screen, do mammogram at age 50 years old and above. I mean that we catch patient from their symptoms, not really a screening population that we like other country has, you know. So next, so what is our project then is Rebung cancer care in primary care is the objective is to develop a training program for general practitioner. Why general practitioner? Because they are the one who close to the community, and then they can encourage, they can empower our patient or even our community to come forward for screening. So for early detection, and mainly we do online training on the 5 most cancer in Malaysia, which is breast cancer, colorectal cancer, lung cancer, prostate cancer, and cervical cancer. So the reason why we do this online training is basically to improve in terms of literacy among our general practitioner about this cancer, and also for cancer screening and early diagnosis. And also we wanted to know, because I'm from University of Malaya, I'm an educator, I would like to evaluate whether our online training is really relevant to our population, to our general practitioner or not, and to improve in terms of cancer screening and early detection. So these are how we develop our online training. It started with a content metric development. There will be a learning outcome from before that, and then we developed a module, and we have a 7 module, which also include the psychosocial as well as a patient's navigation. And the next one, after we develop, this is also involve about 30 professional who is expert in cancer. Okay, not only me alone, but there is a lot more educator in that is like come together, you know, to develop this module. Okay, without them, I don't know whether I can develop this module, because we have 7 modules in total. So after that, we upload in open learning platform. So open learning platform have to pay. Is have to subscribe, and it's quite expensive. So, but because of we have to test somewhere, you know. So we have to start anywhere. So and then we do a pilot testing, and then the last one is called course rollout to primary care providers. So these before that. So these are how the module looks like. I mean, the online training looks like. So we start with a webinar where we'll meet up all the with the general practitioner in Project iEco. It's like Zoom platform. And then during that period of time, if whoever that is not really not sure how to do a technical or have a technical issue in while participating in this online training, we will introduce how to go about it. And then next will be the week 1, they will learn about breast cancer and so on and so forth until psychosocial and also patient's navigation. And this online training is very, I think it's very interesting. Why there's form of gamification, there's case discussion, and then it's exactly like our social media platform where we can like post like a question. If let's say we don't know, we don't understand about this topic, the participant just like write a comment or anything in the in the comment section. So the admin or I'm myself a course director, we will answer whatever question that they have. So it's easy, so that if a general practitioner not sure what are we talking about the module, they can straight away type. It's like our Facebook, like we just simply comment. So I don't understand, just simply comment. It's exactly like that. We will have another webinar or Zoom where we have a case discussion the general practitioner will prepare the cases, and then we will select which one is interesting, and then they will present, and we as from our side, we will give our opinion. All the professional is involved, all the 5 cancers will be there, and also include the psychosocial support as well. So next, so this is what the results when we do pilot testing, which is in 2022, 2 years ago. We actually started 2019, but then because of COVID pandemic, we stopped for a while until 2022 that we can commence implement this online training. And we actually invite 30, you can see how Malaysians were, even though we already invited them, about 31 of GP or doctors, we invited only 13 who participate. And we, as like first time we do this, we feel like, oh, only like 13 only. Out of 31 that we invite, only 13 participate and only 10 completed. So we're thinking how we can improve these numbers. So that's why I think the stakeholder engagement is very important. And then I can see that where we have the engagement with MMA, there is a sudden surge of a participant from 10. We have another, we managed to get about 97 participants on our online training last year, 2023. So from what we found, that the completion rate is still moderate, about 71%, but at least we have 97 participate and 69 completed this online training. So it means that there is some of improvement as compared to our pilot testing. And we found that it's not only the general, clinic kesihatan who involved, but also we have a independent practice, about 21 of them involved in this, participate in this online training. And they found that there is improvement in terms of their knowledge after this online training. And the main thing that I would like to highlight here is most of them would very keen to change their practice. It means that whatever that they have learned from online training, they will change their practice in the future. More than 90% would like to change their practice in each single module. So, and these are the conclusions. So basically, this is online training. Nowadays, everything is like online. Of course, it can give a positive impact because why? It's very easy. Just sit down and do it, rather than we sit down like this face to face. Sometimes some of us will not have enough time. So you just online sit down and then do it. And then most of them agree that they can change. They will change their practice after this online training. And I would like to share the good thing of this. We actually won the awards 2023. We are the winner, alhamdulillah. So we got the Open Learning Global Innovation from our project. So this, with this recognition, from this global, I think it's really motivate us as educators to to give more to our community. With that, I think.
If there's any question for Doctor, would you like to continue this?
Yeah, very good question, of course, because it shouldn't be like just up to 2023, after we got a winner, then we stop. No, we will still continue because I think it's a cancer care must be continued in order to to ensure that our general practitioner is up to date with our cancer screening and the early detection.
Will it be accessible to all GPs that came?
Okay, whether it's accessible or not, that's a very good question because we as a project team, we have a difficulty in terms of funding where we have to subscribe this open learning up to 7,000. If any company would like to help, AstraZeneca again, to fund some of our participants to this project, I would be very grateful with the contribution.
How much do we have to pay?
For the one participant, early bird, we charge about 200 ringgit. Yeah, and the good thing is, we have to pay, and then for the general practitioner, it's very cheap. We just want to encourage them to come forward and then learn. Yeah. It's about 200 ringgit per, and they also can get 20 CPD point. 20 CPD point is enough for the annual, exactly. So that is would be the advantage or benefit for them if they join this online training.
Maybe you can comment on how this is part of the ecosystem.
So basically how it works, when we do pilot testing, it involves klinik kesihatan Taman Medan, also klinik kesihatan Kelana Jaya, and at the end of the discussion, I show you just now, right, the closing event, we will discuss and then we will navigate all the, what we call that, the GP, how to expedite the diagnosis and then how to send this patient that will have symptoms or suspicious or whatsoever to the hospital that is like what we did is now is like Shah Alam Hospital. So we will teach them and navigate help them to assist them how to navigate and then how to expedite to the diagnosis to the hospital. They cannot come to the University of Malaya Medical Center because we are different. We are Ministry of Health. We are Ministry of Higher Education, not a Ministry of Health. So they have to pay more if they come to us. Yeah.
Sorry. I'm so sorry about that. Academicians, there's a lot to discuss. I completely understand, but I must proceed. Thank you so much, Doctor. And again, yes.